Hi, good morning. My name is Mandeep Kaur. Today, here I am going to present our presentation regarding the topic of trainee hires, along with my team members, Amanpreet Singh, Amandeep Kaur, and Nikita. So, here, firstly, I am going to give an introduction about our topic. So, as we all know that great employees are not born, they are trained because professional training is the foundation of success in any workplace. Apart from this, by investing in training program, enhance employee skill, which lead to get higher job satisfaction and improve their performance. Furthermore, effective guidance provides support to new one and help them to adapt quickly with their role. However, regular performance assessment ensure that employee skill aligns with the company standard and fostering continuous growth. By focusing on training program and guidance performance review, organization create a culture and of continuous improvement and success. So, moving to the next slide, the question is why it is so important. So, the first point is ensure safe and effective patient care. Proper training equipment help healthcare professional with necessary skills to provide safe and effective care. It reduces the likelihood of error and enhance patient outcome. So the second point is reduce turnover and burnout. Adequate training development program can alleviate stress and prevent burnout among healthcare workers, leading to higher job satisfaction and retention rate. So the last point is enhance teamwork and communication. Training program that focus on teamwork and communication foster a collaborative environment which is essential for patient safety and effective healthcare delivery. So, in this slide, I am going to talk about organizational responsibility. The first point is comprehensive training program. These are structured education courses designed to provide individuals with a thorough understanding of their role and organization operation. Such programs implement employee with the necessary skill and knowledge to perform effectively, which also lead to increased job satisfaction and productivity. So the second point is skill-based training session. Focus on developing specific comprehensive skill-based training sessions are tailored to meet the demand of particular job function. They enable employee to acquire practical skills that directly apply to their daily tasks, enhance efficiency and performance. So the last but the not least, continuous professional development. Continuous professional development refers to the ongoing process of acquiring new skills and knowledge throughout an individual career. Organizations support continuous professional development by offering opportunities such as workshops, seminars, and courses that ensure employees stay connected with industry trend and advancement. This commitment to lifelong learning contribute to professional growth as well as organization success. So the next slide will be continued by my other team member.
Hello friends. So now I'll be talking about the orientation process. The orientation process for new nurses is divided into three key phases. The first phase is initial training phase. It lasts for first few weeks. In this phase, it is crucial for the new hires to familiarize the hospital policies, procedures and expectations. The nurses receive training on basis of their skills, patient safety protocols, and electronic health records. And then comes the mentorship phase, which lasts for 1 to 3 months. In this phase, a mentor, typically an experienced nurse, guides the new hires through daily tasks, ensuring they develop confidence and competence in the care that they provide to their patients. This phase encourages hands-on learning and helps in adapting to the hospital environment. And then comes the evaluation and feedback, which is an ongoing process. Continuous feedback is provided to assess the nurse's progress. Regular evaluations ensure that nurses are meeting performance expectation and identify areas for improvement. So guys, now I'll be talking about effective training strategies. To ensure that the nurses are well prepared, the following training strategies are used. So these are mainly three strategies. The first one is stimulation based learning. So in this, nurses they practice real life scenarios but in a controlled environment. This not only enhances their decision making skills but also helps them to remain calm in real life scenarios. And the next is case based discussions. So in these, learning through real patient cases, which enhances the problem solving abilities and also the clinical judgment of the nurses, but it is also under the supervision of a trained or experienced nurse. And the last is peer learning and collaboration. So in this, we encourage the nurse to indulge more in teamwork among new hires and foster a supportive learning environment. Nurses learn from each other's experiences, building confidence and improving communication. And these were the effective training strategies. In this slide, I'll be talking about common challenges in training. Despite structured training programs provided by the hospitals, several changes can arise. Such challenges like time constraints, busy hospital schedules can limit dedicated training time for the new hires, thus slowing their transition to the hospital. Then, lack of standard training. Variations in training program approaches can lead to inconsistencies in skill development and also can limit the confidence of the new hires. Emotional stress and burnout. New nurses often face anxiety and high stress, which can affect their performance and retention of what they have learned during their training process. And now I'll be talking about how we can overcome such training challenges. To address these challenges, hospitals implement variety of methods so that they can overcome such challenges, such as allocating dedicated preceptors, assigning experienced nurses to mentor and support new hires, and then providing emotional and psychological support. Recognizing the mental strain of the job and offering counseling or peer support groups can help the new nurses to overcome the strain or the burnout when they go to trainings and work in actual clinical settings. And then regular check-ins and progress reviews, ensuring that new hires receive consistent feedback and support, helping them stay on track and feel valued, can also help us to overcome such training challenges.
Good morning, my name is Amandeep Kaur, and today I will be discussing the crucial role of nurse educators, focusing on three key responsibilities. The first one is designing evidence based training programs. First, nursing educators are responsible for designing evidence based training programs. This means that they develop educational content and curriculums based on the latest research, clinical guidelines, and best practices. Evidence based training ensures that nurses are equipped with most up to date knowledge and skills, improving patient care outcomes. These programs may include theoretical knowledge and skills, simulation based training, and case studies to help nurses apply their knowledge in real life scenarios. Next is facilitating skill development. Beyond theory, nurse educators actively facilitate skill development. They teach essential clinical skills such as patient assessments, medication administration, and emergency response techniques. This often involves hands on training in simulation labs or real world settings where students and practicing nurses can refine their technique in a controlled environment. By providing guidance, feedback, and mentorship, nursing educators help nurses build confidence and proficiency in the practice. Next, the third one is assessing competency and knowledge retention. Lastly, assessing competency and knowledge retention is crucial responsibility. Nurse educators evaluate whether learners have effectively absorbed and can apply what they have learned. This is done through written exams, practical demonstrations, and clinical assessments. Regular competency evaluations ensures nurses continue to meet professional standards, provide safe patient care, and stay updated with advancements in healthcare. Next, we will move to the performance assessment for new hires. To ensure new nurses are ready for the challenges of acute care, their performance must be assessed using specific criteria. First is assessing the clinical skills competency. New nurses must demonstrate proficiency in essential medical procedures such as medicine administration, wound care, and patient monitoring. Their ability to apply theoretical knowledge is very in the real life situations is very crucial. Then is critical thinking and decision making. In acute care, quick, informed decisions can save lives. New nurses should be able to assess patient conditions, identify complications, and act accordingly. Communication and teamwork abilities. Healthcare is a team effort, so nurses must effectively communicate with patients, families, and colleagues to ensure coordinated care. Adherence to hospital protocols, following institutional policies and infection control measures, and ethical guidelines is essential for maintaining a safe healthcare environment. We will be discussing methods of assessing performance. To evaluate new hires, hospitals use different methods to ensure they meet competency standards. First one is direct observation. In this, experienced nurses or preceptors observe new hires during their shifts, assessing their ability to perform procedures and interact with patients and manage workload efficiently. Next is written competency test. Many hospitals conduct exams covering topics like emergency response protocols, medication safety, hospital policies to test theoretical knowledge. Also, the third one is self reflection and peer feedback. In this, encouraging new hires to reflect on their experience helps them understand their identify and understand strengths and areas for improvement. Peer feedback also provides additional insights and promotes teamwork. Now we will be discussing long-term benefits of structured training. A well-designed training program benefits not only new nurses but also the entire healthcare system. It results in increased nurse retention. When nurses feel supported and confident in their jobs, reducing turnover rates and staffing shortages. Next is improved patient outcomes. Effective training leads to few medical errors, better patient monitoring, and enhanced recovery rates, which ultimately leads to improvement in healthcare quality. Next is strong workplace culture. A structured training approach creates a collaborative and positive work environment where nurses support each other and continue to grow professionally.
Good morning, everyone. Myself, Nikita, gonna put forward my opinion regarding future recommendation. My first point is related to the develop more mentorship programs. I would say programs are very much important in the hospital settings as we need updations regarding the professional needs. If nurses are educated enough, then they would have a good guidance and support regarding every patient setting care. Secondly, increase funding for training. If we would have a good training and the funds are enough for all the hospital settings, then there would be a workplace environment where all the environment would leads to a good result of a good knowledgeable nurses. Last, but the use technology for training. I would say in this era, as technology is growing by leaps and bounds, the technology can help us to increase and to grasp new learning by stimulations like video calls, conferences, and also on. It can add a new learning for nurses to enhance their knowledge and to grasp something. Moving forward towards the difficulties of training new nurses. First of all, it is about the time constraint. Nurses and mentors often have a busy schedule, making it difficult to dedicate enough time for proper training. And it is very much important to have a proper training. Balancing patient care and mentorship becomes a challenge. Secondly, the mentors' availability. Sometimes experienced mentors are not always available for us. This can delay learning and leave new nurses feeling unsupported. Last but not the least, it's about adapting to the hospital culture. Every hospital have different rules, regulation, and the work culture. For new nursing students adjusting to these expectations, I feel like while learning clinical skills can be overwhelming and it can cause more challenging struggles and hurdles in their life. Conclusion and key takeaways. First point is about importance of structured training. Training helps new nurses learn the skills need for safe patient care. It reduces stress, builds confidence, and improves job satisfaction. Well-structured training program ensure nurses meet hospital rules and regulation. Moreover, the second point about rules of mentorship in nursing success, a good mentors are very important for everyone's life to achieve something in their life. A good mentor provides guidance and encouragement to reach their goals. Mentor help a new nurse adapt to the hospital environment. Strong membership improves teamwork and communication. Although continuous learning and performance evaluation also plays a very crucial role, as learning is a lifelong process, nurse should keep learning to stay updated with the new healthcare professional settings. Regular performance review help identify strengths and area of improvements. Feedback from their mentors help them to improve themselves in every aspect to make a better version of themselves. Last but not the least is the call to the action. Hospitals should invest in better training programs so that a nurse can upgrade themselves in a better way. More resources and technology can help improve learning experiences. All well-trained nursing team means better patient care and healthier workplace. This was the end of our presentation. I hope we all have made our point clear about training new hires. And these all are the references which we have taken from the course and from the other website too. And last but not the least, I would end at the point that strong mentorship, proper resources, and innovative trainings are the key to shaping confident and skilled future nurse. What do you guys feel? And thank you for being patient and listening to us.